Welcome everybody to our first research conversation presentation for 2024 for ACEN. And I'll just be very brief so that we can maximise the time for our presenter today. So in the spirit of reconciliation, the Australian Collaborative Education Network, ACEN, acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. All of us have a shared responsibility to work toward justice and equity. I'm Elizabeth Cook from Edith Cowan University, and I recognise and thank the Noongar Whadjuk people who are the traditional custodians of the land upon which I live and work. Our presenter today is Dr. Romany Martin, who is located on Lutruwita, which is the land of the Palawa and Pakana people. Dr. Martin is a physiotherapist and lecturer at the Launceston General Hospital and the University of Tasmania, respectively. Prior to these appointments, she worked in acute hospital settings across southeast Queensland. Dr. Martin has a PhD in teaching and learning from the University of Queensland, titled Preparing and Supporting New Graduate Physiotherapists for Rural Practice. Her research focuses on preparing students and new graduates for the realities of practice in physiotherapy and more broadly across allied health. Dr. Martin has published about the use of simulation for development of rural empathy and about mentorship of new graduates across multiple practice settings. And Dr. Martin's presentation today will share the findings of her research, which was funded by a 2022 ACEN Early Career Researcher research grant. And before I hand over to Romany, if you have any connection issues during the webinar, please try first logging out and then returning in with the same URL that you were sent in the email, or wait for an email with instructions on how to join. After Romany's presentation, there will be time for questions, and you can post questions in the chat for us to go through at the end. The presentation will go for about 45 minutes, and then there'll be about 15 minutes of question times. Okay, so over to you, Romany.
Fantastic. Thank you for the lovely introduction, Elizabeth, and thank you for everyone for joining this afternoon, apologies, morning, depending on where you are. I'll start my slide sharing and try and make that a relatively seamless process. There we go. Fantastic.
We've got your calendar at the moment.
Oh no, my apologies.
That's okay. Oh, there we have it. We're beautiful.
Can you see a slide instead of my diary?
Yes, we see your slides.
It's always impressive what you end up sharing instead of the intended thing, isn't it? Okay. Thank you for joining, everyone. My name's Dr. Romany Martin, and today I'll be presenting about supporting allied health students during rural clinical placements. So first and foremost, I'd like to do an acknowledgement of country. We acknowledge the Palawa and Pakana people of Lutruwita, the traditional owners of the land upon which we live and work. So the Palawa and Pakana are the Tasmanian Aboriginals, and Lutruwita being Tasmania. And I'm currently residing on the Pakana lands, which is on the north coast of Tasmania. So I'm on the Bass Strait. We pay respects to the elders past and present as the knowledge holders and sharers. We honour their strong culture and knowledges as vital to the self-determination, well-being and resilience of their communities. And we stand for a future that profoundly respects and acknowledges Aboriginal perspectives, cultures, language and history. Fantastic. I might just get a nod from Elizabeth if that's okay. Can you see the presenter view or my proper slides?
I see your proper slide as the full most of the screen, and then your little face on the side.
Wonderful. Thank you.
That's okay.
Okay. I'd also like to acknowledge all of the people that contributed to this project today. So colleagues from around Australia, a big thank you for all of their work and support of the project. Without their time and efforts, it would not have been possible. I would also like to thank the funding body, ACEN, for their early career research grant, which was in 2022, for the project, which at the time was titled Allied Health Students Work Integrated Learning During Rural Clinical Placement. So what I might get everyone to do, which is about as interactive as I like Zoom sessions to be myself, is if you're willing, pop what profession you work in, what area you work in, into the chat, and hopefully that will provide a bit of insight into how the information today might be relevant for you guys. I've given this presentation a couple of times before, having completed the project, but it's always been to rooms full of allied health professionals. So it will be fantastic to know where you guys are coming from, and whether or not you think that any of the things that we found within our allied health cohorts might be relevant, transferable, appropriate for whatever communities and industries you're working with. So thank you for putting your thoughts in the chat. A couple of nursings, hospitality, nursing and allied health, health faculty management, psych, placement coordination, fantastic. Oh, fashion and textiles, that's really cool. It would be fantastic to learn about whether or not you guys think these findings are transferable. So when you think about student placement, work integrated learning, professional experience placement, and then you think about that in a rural context, there are some common worries that pop up. So not worries in terms of existential crisis or who's going to win the AFL grand final, but worries in terms of how are we going to support the students on these placements? Are we going to have enough? Resources? What are other educators doing? How might we make the students feel welcome if they're living away from home? What if the students are the only student here at the time because we can only cater for one student? These things are things that we'd heard a lot over working at the university. I have a role to do with placements, and it was a common theme that kept arising with people saying, these are the things we're worried about. What can we do to help rural placements? When we think about rural Australia and rural health, so this framework is unique to health, just to keep in mind, there are factors to consider that are going to be in interplay anytime we're thinking about rural and remote health situations in Australia. So this is a framework that's been published by Burke et al. In 2012, and they identified 6 factors that you can use to categorize a context or a scenario from a conceptual standpoint. So the first one is geographic isolation. So that relates to all of the factors that are caused by being geographically isolated. The next one is the rural locale. So that references the culture and the social norms of the people who live in that location, and that's going to be unique to every individual scenario. You've also got the local health responses. So that is referencing the policies, systems, and processes that are occurring in that location, and that is again unique to each individual context. You've then got the broader health system. So that might be at a state level or a federal level, depending on how you're funded or where you're operating. A local health response versus a broader health system. An example of that might be how the Mount Isa Hospital operates, as opposed to how Queensland Health operates above the Mount Isa Hospital. Or another example would be the St Helens Hospital in Tasmania, and then the Tasmanian health system. So those sorts of different levels. The social structures, so the communities that live within this context and within these locations, and then power. So whilst that's a little more abstract, it's referencing who holds the power, who holds the sway, how much collaboration is facilitated, those sorts of constructs. So when we're looking at rural placements, we can expect that our students are going to have to engage with all of these variables whilst they're out and about on their placements. And it's not common that we label them up this way, but it can be really helpful when we're doing research or when we're looking for strategies to overcome barriers and facilitators. So thinking back to all those worries at the beginning, the questions that we had were, how do we support students to have positive experience during rural clinical placement for the sake of the student? And how do we do it in a way that's sustainable? So this was from the educator perspective. How do we make sure that we're both looking after our students and also looking after our educators? Because there is a lot of existing literature about the challenges that arise for educators when they're trying to support rural clinical placements. Why do we care about it? If we take a very university lens or constantly questioning, but why are we interested in this? We know that going on rural placement and having positive experiences on rural placement leads to increased rural intentions and increased rural employment in medical students. That was a 2018 systematic review. When we're looking at allied health professionals, if we're looking at who ends up working rurally, we know that 40 to 66% of rural allied health had a rural origin. So that's people who live rurally, training as allied health professionals and returning to a rural location. And then approximately 50% had some rural training experience. And then I think this is really interesting. After controlling for rural background, so irrespective of having lived rurally or being from a rural location, rural placement was significantly associated with rural work. So if you have a rural placement, you're more likely to work rurally. In this scoping review, they also found that students perceived the quality of the placement as an important factor. So it's a little bit like a babushka doll. The layers just keep going, a little bit of inception. We know that rural placements improve rural intentions, and that's good for the rural workforce. We know that positive experiences on rural placements are good, but what does that mean? And when we think about positive experience, the most commonly reported mechanism was support. So that's where we landed. We knew that support for rural placement was the most commonly reported mechanism for a positive experience. And that's from a 2020 scoping review of 18 articles. And then that's where our research question landed. So jump there in a second, just some slightly more research demonstrating that there is heaps of evidence that the provision of support during rural placements contributes to positive placement experiences. And that, coming back to the why do we care, the provision of rural clinical placements is considered a key strategy to address the shortage of allied health professionals in a rural workforce. So bringing that whole picture together, we need more rural allied health professionals. Clinical placement does that. We need positive clinical placements. Positive clinical placements look like supported clinical placements. And yeah, it would be interesting to see if that thought train carries over into other areas as well. Okay, so our aim of the project was to triangulate student, clinical educator, and university manager perspectives to explore the support needs of multiple stakeholders during rural placement. So we went out and we asked everyone, how do we support both students and clinical educators during rural placement? What does that look like? We undertook interviews with different stakeholders and then did a thematic analysis of this data. And the interviews were conducted via telephone and video conference in 2022 and 2023. Video conference and telephone, both allowing us to get, access to lots of people in diverse locations. These are the questions that we were asking people over the phone, just for people to refer back to if they're interested in setting up similar projects. From the student side of things, we were asking both positive and negative questions. What were positive parts? What parts were you challenged by? What was good support? What was bad support? And then from the educator perspective, we were asking similar questions about both supporting the student, how do you positively support the student, what didn't work so well, and then also asking how do you feel you can be supported by both the university and by the processes in your workplace. This was our demographics. So we ended up with 13 students and 11 clinical educators across a broad range of locations, mostly working in public hospitals. And we had representation either in the clinical educator or the student cohorts across physio, OT, speech, dietetics, exercise physiology, and pharmacy. One of the challenges was getting a broad scope of professionals, as the strategy that we used that was most efficient given the resources we had was a snowballing strategy, and that was challenging because people are so busy and are potentially less likely to do research opportunities outside of their additional time. I've presented the 3 themes here that were generated from the data, how they were presented in the research findings. So I'm going to talk through them, how they were presented for the publication, and then I'll also talk through them in a more pragmatic way in terms of how we present them for resources and for end stakeholders, because what we find is that often the way it gets presented in publications isn't super useful for knowledge translation into the workforce and people who are actually going to use it. So the first theme was being flexible and adaptive, and that had 2 sub-themes about the flexibility of team structure. So that was who's the models of clinical education, is it 1 to 2, who's taking the student. The take-home was to be flexible, and then adjusting to the needs of the student. So there was a huge need to adjust the support that was provided based on the needs of the student. And whilst that sounds very common sense, the range of support needs of students in rural locations was deemed to be higher. So, for example, some students might have never been to a rural location before, and that student might have needed heaps of psychosocial support to manage their clinical placement experience. Bespoke to rural practice is referencing that just how unique rural practice is. So diversity on top of complexity, that's referencing the diversity of the caseload that you come across in rural practice as an allied health practitioner. You might be, for example, the only OT that works in your location, and you might have a pediatric case in the morning and a geriatric case in the afternoon. And that would be a normal day. And then on top of that spread of caseload is the complexity. So whilst if you're working in a metropolitan centre, the really complex individuals might be streamlined to a senior clinician or a specialty clinic. If you're the only OT within 500 kilometres, then you're going to be seeing everyone. So some of the challenges that arose from that. A related sub-theme is the expectation reality gap. So a lot of students arrive on rural clinical placement, and they think that because of the diversity and the complexity, it's a sink or swim situation. They feel like they have to be across everything to be passing this placement, when that's not the expectation. So making sure that the student and the clinical educator's expectations are aligned, and also the expectations of the university and the clinical educator. So ensuring that the clinical educator knows what this student has covered, so that they don't get a rude shock when the student arrives and might overshoot or undershoot these expectations. Bespoke to rural practice also included the culture of the rural patient cohort. So that's referencing the unique things that occur in rural communities. For example, occupations relating to farming, increased time spent in cars, increased transits back from hospitals to home, challenges for discharge, these sorts of barriers. And then finally, within a culture of teamwork. So that's referencing the teamwork that occurs in rural health facilities, both from an interprofessional perspective and within the vertical structure of professions and organisations. The transitional relationship is referencing the relationship between a student and a clinical educator, and I'll touch on that in a few slides. And then support from the interprofessional team. So really leaning into that interprofessional support was seen to facilitate better experiences on clinical placement. The paper's been submitted to the International Journal of Work Integrated Learning in October or November last year, off the top of my head. So hopefully we'll hear back from them soon, very excitingly. And then rolling into the great, so what? How does this help people actually on the ground? I've divided it up into the challenges, the things that create challenges for support, and then on the flip side of that coin, looking at the strategies that can be used to overcome these supports. So first and foremost, an understanding of the factors that create challenges from the perspectives of both CEs and students. Staffing. So staffing in rural locations is really challenging due to a number of factors. There are chronic resource challenges in terms of getting staff to the locations. And then on top of that, because of smaller teams, there's less of a buffer if someone is away. So if you're the only professional in that location and you've got a student and you have to take sick leave, then there is no one else from your profession that can supervise that student for the day. So that's where opportunities to lean into the interprofessional team and create opportunities for supervision from other health professionals that are relevant to that student's learning are beneficial. And a lot of students said that this was a really beneficial part of rural placement. It was seen as a positive opportunity to go and learn more about other professionals. Whereas if you're working at the Royal Brisbane and you're in a team of 110 physios and you learn a lot from your 110 other physios that you're working around, but you might not get as much opportunity to sit down at lunchtime and talk to the podiatrist or talk to the speechy, these sorts of opportunities. So being flexible with staffing, having strategies in place to make sure that there are opportunities for student learning if things were to happen and the clinical educator wasn't around on the day. Complexity and diversity of practice. So this is the challenge that was really experienced by both clinical educators and students. And this is what I was touching on before about the aligning expectations so that the student doesn't feel like they're constantly sinking, as opposed to being able to grasp the whole scope of the profession in a 2-week, 4-week, 5-week placement. And then the final challenge was the, psychosocial support. So thinking about if the support needs of the student in that location. So if the student has never been to a rural location before, then they're going to need support to overcome some of those challenges. Some of the challenges that were voiced in terms of psychosocial support, and it would be interesting to hear others if this occurs outside of health as well, is a lot of our undergraduate cohort might not have lived out of home before, and that's not a comment about their capacity to engage as adults in society. I think it's more of a comment about cost of living crisis, cost of buying houses, intergenerational wealth, all of these things, that a lot of students struggle when they have to go on a rural placement because they've never been out of home, and then suddenly they're away from all their established support networks, and it's costly, and placement itself under usual circumstances is quite stressful. So making sure that the psychosocial support can address or acknowledge some of the challenges that the student might be experiencing. Okay, so those are the 3 things that are challenging for supportive placements. These are 3 things that are perceived to contribute to positive experiences and address those support needs. So being flexible and adaptive. So that flexibility in terms of staffing structure and really adaptive to the needs of the student. And a lot of that is about clear communication. So really establishing at the very beginning of the placement how you can provide support for the student and what the student needs support with, and encouraging the student to feel like they can raise issues so that they are seeking that support as opposed to suffering silently. We then also have above and beyond. And this is by no means suggesting that there's an expectation of rural workforces to go above and beyond to accommodate students in their location. What was voiced by clinical educators in all of the interviews is that educators were happy to go above and beyond, and it was in the little things that might not occur in a metropolitan setting. So one example of this might be a student who's on a 10-week placement who relocates to rural Victoria, and the CE knows that they don't have a car, they're walking to the hospital every day, and they've got no supports where they are. And then in week 1 of their 10 weeks, they catch COVID and they're inside isolating for a week. And this CE being clinical educator, talked about dropping groceries around to the student in acknowledgement that they didn't have any other support structures for their placement. So that's one example of going above and beyond. Another example might be including students in any local events that might be occurring, or letting them know things are going on. If there's agricultural shows or rodeos or anything like that that's happening. And other examples also include tying the student in with new graduates or other social activities that might be happening if everyone's going camping or there's something happening. Those sorts of supports of going above and beyond can be really helpful for facilitating positive student experiences. Translational relationships. Photo of myself there because I was clearly running out of photos to use in the presentation slides. So transitional or translational relationships are a phenomenon that our clinical educators talked about, whereby a lot of students who attend a rural location as a student then return to that location as a new graduate. And this pattern happened so often that clinical educators started to view their students not as students, but as colleagues, because so commonly their students turned into colleagues anyway. So this created a sense of collegial mentorship as opposed to purely alienated clinical educational supervision, where clinical educators and students felt like they were more part of the team and more involved in positively influencing the health of the people that they were working with. And I thought that was a lovely finding about some of the unique positives that come out of rural placements is this opportunity for a translational relationship where it's not, yes, you start as a student, but as soon as you start developing, you are part of that transition into just being a colleague and being part of the team. So I think voicing that to students can really facilitate a positive experience as well. Okay, so recommendations from the research project. We've got a publication that's purely drawn from the interview data. We've also been able to, in collaboration with industry partners, come up with some fact sheets that are supported by the research, but are also extend on the research. So they hope to answer some of those worries that we were talking about at the very beginning of the presentation. So how do we prepare students? What do we do with them? What does this look like? How do we support them? Those sorts of things. Before the placement, things that you can do are make sure that you're communicating to students about the expected knowledge and skills. So we're expecting you to be able to do this. And that might not mean that they're competent across every area of practice, but just letting them know that when they arrive, this is what it might look like, but we're not expecting you to know everything can be really helpful. It's important that universities communicate to clinical educators about what the student has covered it's important that universities support educators to provide clinical education. So whether this is providing training in the resources that they might have to use to assess the student, or working with clinical educators through scenarios or challenging situations that might arise can be helpful. And then also on both behalf of the university and the clinical educator, orientating the student to rurality. So explain what the town is like can be useful. Does the petrol station close on Sundays? Do groceries arrive on Mondays and you can't, if you don't get them by Thursday, then you're not going to get groceries till next Monday? Is there a river that floods every year at the same time? These sorts of questions. During the placement, lean into the interprofessional team. So students really saw that as a benefit of rural placement. So using that to the best of everyone's advantage. Ensuring that you are, if you think it's going to be beneficial, leaning into that model of collegial mentorship, where the student is part of the smaller team and they are reflecting on those sorts of approaches. And then also having some strategies in place for challenges to staffing or educator availability. So with that smaller rural team, you've got a smaller buffer if someone is unwell, planning who might take the student if your main educator isn't available, or if they have to duck off to the wards for the afternoon because a caseload increases or anything like that. And then also planning for the availability of placements. Some clinical educators were worried that they weren't going to be able to provide a placement because there might only be 2, 3, 4 patients a day, and not all of them would be appropriate for students. And whilst that is something to weigh up, it can also be counteracted by other projects or placement-related training opportunities. So the student might be able to do a quality improvement project or other approaches, and definitely encouraging clinical educators to reach out to their universities, the university that the student's from, if they need additional support in providing learning experiences. Adapting to the student. So we've talked about before the placement, we've talked about during the placement. Adapting to the student can look like many things, but what we were advocating for was ask what specifically they might need support with. So similarly to supervising a junior colleague, or if you're working in a line management system, we are often better at establishing what's the problem when we're doing management, as opposed to establishing what's the problem when we're doing clinical education. If students are struggling on clinical placement, commonly the feedback is, oh, they don't know their material, or they haven't learnt this. And I go, okay, that may be the case, but are there also other factors that are playing into this? So in a rural example, is it the rural generous caseload? So is the student thinking that they have to master everything, so they're freezing and not getting back to basics? Is the student struggling with any psychosocial challenges due to being isolated during rural placement, or are they struggling to modify their care to the unique needs of people who live in rural places? Additionally, just keeping in mind that students who have not lived rurally were acknowledged to need additional support if they were unfamiliar with being geographically isolated. And then students on solo placements. I think this is a great takeaway from the project. A lot of students voiced that if they were the only student on a rural placement, they felt like all eyes were on them, and this led to increased performance pressure. Whether or not the CE did that intentionally, or if it was purely the perceptions of the student, it's hard to tell. I work at a university that advocates for sending 2 students to all locations. So the students have got a peer. And I think there's a heap of benefits that arise from that scenario. It does also happen that we send students on solo placements. And one thing that I think was a fantastic point is that facilitating supervisional feedback with a near peer for that solo student is a great way to make them feel supported. So if you've got 2 students on a placement and student A says to student B, oh gosh, I know I should know this, I just don't remember it off the top of my head, can you remember how to do XYZ? And then the students work through that together and they do a bit of peer learning. If the student's the solo student on a placement, they are much less likely, I have nothing to back this up, I think they would be much less likely to go to their clinical educator who's also marking them and say, look, I'm sorry, I just don't remember off the top of my head. Do you know how to do XYZ? So they lose that informal opportunities for feedback and support in a safe environment. So potentially peering that student up with another junior staff member, for example, a new graduate. So if you've got a new grad who's in their first year of practice and a final year student, and you facilitate a half an hour weekly catch up between the two, that can provide great opportunities for the student to feel like they've got that support. And they can ask those informal questions that you might be embarrassed to ask your educator. Of course, acknowledging that we strive to have professional relationships with our students where they feel they can ask us anything. I don't think it always works out to be the case. Alrighty. So ways to overcome challenges with staffing a caseload. Again, that flexibility of team structure, multiple clinicians from the same profession being orientated to taking students or feeling comfortable for taking students, or arrangements with interprofessional or multi-D supervision is also great. And then considering quality improvement projects or other tasks that students can complete independently. So all those recommendations have been put into 2 fact sheets, and these are big A3 PDFs that are publicly available, and there's links for them in the slides, and I'm also very happy to email you guys the links if you are interested in using them or you think they'll be helpful for your organisation. The first fact sheet is about support needs of allied health students on rural placement. So this is a really micro look. What do you do whilst the student is there? Individual clinical educator to student relationship. And the second fact sheet is about creating supportive rural placements. So this is a broader lens looking at how universities and health institutions can create policies and procedures for supportive rural placements. So this is the first one about supporting allied health students, that micro lens of the small interface. And it touches on being flexible, being adaptive, and being bespoke to rural practice. A little bit blurry from the screenshot that I've taken, but that flexibility, multiple clinicians or from the same or other professions, and then trying to create opportunities for solo students to have near peer supervision. And then being adaptive to each student is considering what are they struggling with and adapting their caseload or the psychosocial challenges if you can. And then trying to acknowledge that those who haven't lived rurally before might need additional support. And being bespoke to rural practice. So students may be challenged by the breadth and complexity, and then this expectation reality gap. So trying to align expectations is such an important part of feeling like you're supported and you're achieving well and you're meeting expectations. There also just a point to note about discipline-specific guidance about adapting to rural-specific challenges. So seasonal weather challenges, agricultural occupations, limited access to healthcare, or belief systems associated with stoicism. So there's one story that's gone around multiple times about a student who had told a patient discharging that they weren't allowed to sit down for more than 15 minutes at a time, but he was driving himself back to his farm, which was 5.5 hours away, and the patient's left wondering if he has to stop the car and walk every 15 minutes for 5.5 hours. These sorts of scenarios where students might not, in the learning of the skill, might not be cognizant of where to place the importance of rural specific factors. How close to the top do you place that? This is the second resource, which is about creating supportive rural placements. And it's got before placement and then during placement, and this is that macro lens. So thinking about the clinical expectations, trying to align the expectations of the clinical educator and the university, preparing educators. So universities can support educators to facilitate this. So whether there's training that they can provide or brainstorming on problem solving through certain scenarios can be really helpful. And then prior to the placement, orientating students to rurality. So are the shops open on Sundays? Is there public transport? What accommodation is there? These sorts of questions. And then finally, during rural placement, so leaning into that interprofessional team, students viewed opportunities to learn about other professions as a positive of rural placement. So I think we should be highlighting that. A transitional relationship, so the model of collegial mentorship, where students are welcomed into the community and then might return to the community as a new graduate. And then redundancy planning. So acknowledging that things change. Commonly universities approach placement providers a year out or 18 months prior to the placement occurring, depending on how established the university is. And no one knows what their staffing is going to be like in 18 months. So ensuring that there are processes or at least conversations in place to support clinical educators who might be taking students amongst all those challenges. These are the links for the resources. And again, they're publicly available for download. And if you would like me to email you the links, I'm very happy to. And these are the references from today. And a very big thank you for listening to the presentation. And it'll be great to read through the chat and answer any questions.
Thank you so much. It was a brilliant presentation. I really enjoyed it. And I can really relate to a lot of the things that you said. I did teaching, a master of teaching, and I actually, they advertised in lectures, in mainstream lectures, that there was an opportunity for rural placements in my degree. And they had some students come in and talk about their experiences, and a lot of the themes that you mentioned actually were advertised, like the transdisciplinary thing. And even though it was teaching, it was very, the insights I gained from that presentation were basically a lot of that information, and that inspired me to want to go to the rural placement. So I applied for that opportunity, and it really was exactly what you sort of portrayed in that presentation, which was really cool, because that's teaching, and that's quite different from allied health. But I could see a lot of similarities in my experience with what you found in your research. So yeah, really interesting, and I'm sure that's it. It'll be interesting to see what other people say. So if anybody has any questions, we do have a question from somebody saying, could you put the links in the chat to those open access resources?
Yep, I can do that. Absolutely. I'll do it now, and then I won't forget at the end.
Yep. We'll let you focus. I'll let
No,
you focus on
okay.
that.
I'm not very good at doing two things at once.
No, nobody is, don't worry. It was a great presentation. There's lots of comments about how wonderful that was. It was really polished.
Thank you. I appreciate it. Thank you. Fantastic to hear that you had similar experiences in teaching, because I think there's so much that we get within allied health. We get stuck in our own professions, and I think, oh, this is a physiotherapy specific problem, and then you turn around and it's actually an allied health problem, and then you turn around and it's actually just anyone who has work integrated learning. This is a problem for work integrated learning.
Yep.
And I'm sure, jumping to assumptions here, that rural staffing in teaching might be a challenge, and that potentially it's, a strategy that something we could all be sharing with.
Yeah, definitely. And the examples you gave of helping students with sort of getting acclimatized to the culture and how it is in a rural location by inviting them to events and things like that happened to me when I was in my rural experience, and even though it was like really challenging and I did feel a lot out of my depth a lot of the time, it was those experiences that made you feel like you're part of something and part of the community. So they welcomed you into the community, and that's what's special about rural locations anyway. Like, it's very much about that. And then I went on and actually worked I applied for a job in a remote community because of the experience I had in my rural placement. So it does inspire people to want to actually go on to work in the regions, and so it's what's needed as well to help to fill those workforce shortages.
Yeah.
There is a comment from Tom Worthington that there's similar to experience of computer interns in remote areas and small companies. So that's interesting.
That is interesting. Because I have often wondered if it a lot of publicly systematic things, I can see the transfer across, but interesting that even in small internee type non-public health service that there's still that same experience.
Yeah.
Actually,
I think it might be something about when you're in a regional or remote community working on placement and then working, you see a more systematized view of everything. Like, because everything's more transparent. There's not as much going on there's a lot going on, but you're able to get a clear view of everything, and you're supported to see everything, because everybody needs to know about everything in order to work as effectively as a cohesive team. And that doesn't really happen as much, I don't think, in city places where you work, because there's more people doing different jobs and you can't possibly know everything that's going on. But in a smaller workplace environment, you get that real deep systems thinking, learning that you would probably not necessarily get in other environments. And I think that's really valuable for any student to learn how to think more broadly about all the different aspects of the environment, and the social aspects and the cultural aspects, and how they all interweave into the experience. So I don't know if anybody else sort of thinks like that too. More responsibility earlier as well, Dimity said. I agree with that, in that you tend to be given more thrown in the deep end moments in a rural situation, which is really good. It's really challenging, but you're supported, and it's a safe place to be thrown into the deep end in a way, usually, if you've got a good support.
Hopefully.
Yeah,
we hope.
Hopefully.
Yeah, there is a lot of the catch-22 of the really positive parts about rural placement can also be the challenges, and it's about acknowledging that this is it's almost that I need to stop using the word challenge. This is a factor, and if you are appropriately supported, this will be an exceptional advantage or benefit. But if you are inappropriately supported or prepared, or whatever factor has led to that negative outcome, then it's really going to be a challenge. And it's a funny part of trying to make sure that we are having ongoing, good relationships with our rural providers, because they are so fundamental to our students having positive experiences. And I think potentially, just with my role at the university being to do the clinical placement related work, is that I feel so it's my responsibility to support the educators so that they can support the students. And yeah, I suppose they might have a different opinion. They might think I'm not supporting them at all. So well, I can't talk for them. But it's certainly something that I try and make happen.
Yeah. There's more comments. Some people have shared. Donna Ballard has shared. I thought I would share this link as a response that the Mid-Coast New South Wales community has established to assist newcomers to rural settings for placements and work. And there's a link to that if people want to check it out.
That's fantastic.
Natalie Ellis says that we send a welcome email to all students doing placement in our footprint with contact details if they need support, and also about local scholarships for financial support if you are more than 100 kilometres from home. That's a great idea. So like initiating them before they even get there with a whole lot of support about the region and the supports available.
Lots of fantastic things happening.
Yeah. At uni SA for rural placements, we send a welcome pack, so they do it too. Prior to placement, this has some merchandise and the QR code for the region's guide. Cool.
Very cool.
We also send a guide exploring placements, and people are sharing their guides in the chat, which is fantastic.
Thank you for sharing the resources, everyone. It certainly makes it's fantastic to sort of, when we are able for this to be a collaborative space, because we are all working towards the same goal, or I would like to think we are anyway.
Yep. Yeah, we definitely are. Especially because we really need a lot more rural practitioners because of the workforce shortages. So it's an important thing to promote and to provide support to students so that they have a good experience, but also you want students to have a good experience at university, and if they have not a good experience on their placement, they're probably going to also, it's going to affect their university experience as well, and their learning. And sometimes it might be a good thing if they realize that this job that they're heading towards doesn't suit them particularly. Like that can be a helpful thing at the end of the day for a student if they find that they don't actually like the placement and like what they're doing, but I guess you want them to have a positive experience regardless.
Exactly. And there are so many students that come back from a rural placement and are shocked by the breadth of what their profession contributes to and is able to achieve. And I think that's we talk about the scope, the breadth of the scope and the complexity of the scope being a challenge, when in reality it might be exactly what that student needs in that point in time, to appreciate that, it sometimes gets so siloed in large metropolitan hospitals. You might be a physio that sees total knee replacements and that's what you do.
Yeah.
And then, learning about the breadth of what we can do.
That relates a lot to my PhD research, actually. Because I developed a relational employability framework for using teaching that helps students to reflect on both their individual employability development, but also the contributions that they can make to other people, and then also the contributions that they can make to broader society, and so it's like broadening out the concept of employability so that you can and employment. So when you're in the workplace, remembering that it's a whole system that you're working in, it's very holistic, and the great things about work are often those things that aren't what you learn in the discipline. They're those interpersonal relationships that you build and the support that you give other people, and the innovations that you do in the workplace to promote sustainability, like care for the environment that you work in, and all of those kinds of little other tangential things about being employed and in the workforce that are really the things that are motivating, and they remind you of what's important in life and work. So
I think there's a lot of that rurally in terms of the which is potentially facilitated by the work-life balance of rural practice. A lot of our practitioners were talking about, you're rostered for 7 hours, you work for 7 hours. There's none of this, you're rostered for 7 hours, you've got a 2-hour commute and you work for 10 hours. And the things that you do fit in your work time in terms of organising community education programs for a physio session for postnatal health, or a physio session for falls prevention in the community, or working with other organisations in the community that all align to your professional expectations and your code of conduct and everything that the profession aims to be, but falls outside of the scope of read the notes, assess a patient, treat a patient, write about it, repeat. It's that that other side of things that is not unique to rural practice, but might be facilitated by rural practice.
Yeah.
Yeah.
It's
Yeah.
sort of clearer. It's more
Yeah.
in your face. Like you're sort of,
You can't
it's
ignore it.
just part of it. You can't ignore it. It's just part of it. And that's the special part about a rural place, I think,
Yeah.
that you get exposed to these things. Yeah.
Mm.
We have 5 minutes left, and like we're just having a conversation here. So if anybody wants to turn off their mute microphone thing and actually ask a question and I'm losing my internet for some reason. If anybody would like to speak, you can, I think, control your microphone, hopefully. Does anybody have any questions?
Are you planning to do like any, I guess, kind of follow-up research around kind of the impact of these tools? Because I see like there's a lot of modules created across various projects and a lot of resources, but then there never seems to be that next step of, do they have an impact? Which I think gives us a good chance to explore, is it modules or this handouts, or what actually is taking that next step to make that difference?
Yeah, I totally agree with you that there's a lot of people out there that are really good at identifying what we need and what the barriers are, but it's so much harder to do, or not much harder, it's less of a focus to do research that is assessing effectiveness or translational or those sorts of bits and pieces. I work substantively for UTAS, the University of Tasmania, and we're working on a not a module, but a professional development program that we offer to our clinical educators to support them for clinical education around the state. And that is something that a lot of universities already offer. And we haven't come up with a way to evaluate that at this stage. We're still in the design phase of it. But I think it's, just emphasizing a good point that it would be so beneficial to then evaluate and say, hey, this works, or hey, this doesn't work, so other people can try something else or try what we've tried. I'm overly optimistic that based on all of the findings of the research that we've done, that a lot of it's about just having really clear relationships and working relationships and networks within the state or with the providers that you're operating with, so that they feel they can ask you for support and you are able to provide either planned professional development and planned support, or support whenever they ask for it. And I'm hopeful that will lead to some positive changes, but I think that's what everyone already strives for. So it's not particularly unique or different. It's just,
measuring it would be like for that course that you're developing, doing a pre-survey beforehand and then a post as well. But really designing that survey so that it really does get to the crux of how the impact can be demonstrated.
And then there are so many challenges that we have as health systems that it would be tricky, I think, to make it a priority because all of our clinical educators aren't just providing clinical education, they're running whole services, they're running departments, they're engaging with 6 universities, and it's definitely challenging.
I think we're about 1 minute to go. There's another link shared in the chat if you want to click it before the whole Zoom shuts. But thank you so much, Romany. It was a fantastic presentation, and
thank you.
I think everybody got a lot from it, and we're very grateful for you sharing your research findings with us. So looking forward to seeing what's to come from you. I will follow your publications.
Thank you for your time.